Hi everyone, it's Bob. I just wanted to say hello. It's Sunday evening. It's time for my Instagram Live. I'll give a couple minutes for the crowd to draw. Hope everyone's doing well. Sorry, I've got a vest on that somebody gave me. It's a little large for me, but I thought I'd wear it. Hope everyone's doing well tonight. Good evening, it's Bob. Can you hear me okay? Hopefully everyone can hear me. I have my AirPods on tonight. Hopefully be able to get a better, make sure everybody can hear me okay. Can you hear me all right? Hopefully everyone's doing well. Hello back. Hello. See people waving. Hello, Salon Shaheen. How are you? I need a haircut. Hope everyone's doing all right. Good, good, good. All right. Thanks for joining me on a gloomy Sunday. How's everyone? Good. Thank you. I'm doing well. Hope you all are doing well also. Okay, it's Sunday night. We'll give a couple more seconds for the audience to build up a little bit. Then I'll run down through some of the numbers and then take your questions, and hopefully we're doing pretty well here. What a night, huh? Yesterday was so beautiful, and today is not so great. But we'll take what we can get, right? Take what we can get. Okay, so we'll just give it a couple more seconds and then we will get moving. Thank you again for joining me. Sorry if I was a couple minutes late. I don't think I was actually. I think it was maybe a minute late. I was just trying to get my AirPods on. I was charging them up. Hey, Will, how you doing? My colleague, Senator Haskell, is on. Okay. Thanks for joining. Hope you're well. Again, good evening, everyone. All right. Let's see. I think we can probably get started right now. I'll try to be a little louder. How's that? Okay, everyone. So it's again, make sure it's a gloomy day today and a gloomy week kind of coming up from a standpoint of our weather going on. So make sure that everybody takes care of their physical and their mental health as well. We need to make sure that everyone is taking care of themselves and everyone else. So let me just read through some of the numbers as I have them. As of this afternoon, there are 25,289 people who have tested positive for COVID-19 tests. Let's see, 1766 who are hospitalized, more than 200 since Wednesday when I did my last Facebook, and 1,924 have died from COVID. Though I will say that there are fewer hospitalizations. The hospitalization rate seems to be going down a little bit, which is a good thing. But that doesn't mean that we're out of the woods yet, but that is a good sign for sure. Locally in Fairfield County, we have 10,529 people have tested positive, 635 are hospitalized, 707 people have died. In Norwalk, we have 1,483 cases in Norwalk. That's 81 new cases since yesterday and one new death, which brings us up to 69. So we still have to be very careful. We have to make sure that we are doing everything we can to socially distance ourselves and to be safe, because I know a lot of people want to get back to normal, but we have to make sure that we are still practicing good social distancing. We have 178 cases in Darien, 2255 in Stanford, 1768 in Bridgeport, 230 in Westport. Hello, Councilman Roberts, glad you joined. 1321 in Danbury. So that's where we are right now with some of those numbers. So hopefully everybody again is being safe and doing what they need to do. I will say also that there's some good news to report, and everybody likes good news, that the state has received 2 million standard masks for essential workers, 100,000 N95 masks for first responders, and the Governor Lamont announced that we received a $3 million donation of personal protective equipment by Raytheon Technologies for Connecticut, used by first responders and healthcare professionals, so it's really good. Schools and non-essential businesses are closed in Connecticut until at least May 20th, so I know somebody already asked me about where schools are. It's hard to say right now. We don't know. We'll wait for the school administration and also the state to make that decision. I would imagine that's coming anytime soon. So we'll see how that all works now. It depends on what happens over the next few weeks. As far as our cases and hospitalization, and whether we can reasonably or not get people back to work again, and whether we can have large groups, which is the school basically. Any traveler coming into Connecticut for any reason must self-quarantine for 14 days. Governor Lamont is encouraging Connecticut residents, so if you haven't done this yet, please sign up for CT Alert. the state's emergency alert system, which provide text messages and notifications to users. All you have to do is text the keyword COVID-CT to 888-777, 888-777. Just text the keyword COVID-CT. I know Norwalk has a alert system, and so does Darien, so you might want to, if you live in those communities or any community you live in, check to see your town's website whether or not you can sign up for those as well. In Norwalk, they call them Code Reds, and Mayor Rilling does do those calls on a regular basis. Governor Lamont announced that his administration is partnering with the Connecticut Business and Industry Association, CBIA, and its affiliate Constep on an initiative to distribute free face coverings to eligible essential small businesses with fewer than 50 employees. Eligible businesses include those defined as eligible by the Department of Economic and Community Development. So if you're one of those small businesses with 50 or fewer employees, please get in touch with CBIA or Constep and see if you can get some of those masks as well. Also, some good news is that the governor's reported our state has received 2 million standard masks for essential workers and 100,000 N95 masks for first responders as well. Now, a lot of people are asking about cloth masks and coverings. There's been some new guidance from the CDC. There's actually an article on the front page of today's Norwalk Hour. I would imagine it's in all the Hearst papers about which masks are better than others. But remember, unless you're wearing the N95 mask, the masks don't prevent you from getting something. They help for you not to give it to somebody else, such as any kind of virus, such as flu or a cough or anything that comes out of your nose. So you have to have your face and your nose and your mouth covered if you're going to wear a mask, and you need to wear those masks if you go any place where there's going to be lots of people. So please make sure you're wearing those masks. Let's see. The state has partnered with the How We Feel app, and I'll just go grab my phone here so maybe you all can see it. And I check into it every day. This is it right here, How We Feel, and just download it on Google Play or the Apple Store. And you just check in once a day, and it's meant that basically, like other countries are doing, is to, but it's, I think, more anonymous, but it's just in areas to define where the hot spots are, how people are feeling, if we have people who might have COVID in certain areas. So all you got to do is just put in my zip code and check in once a day, and you're ready to go. It's really, really easy. So we ask people to go to the How We Feel app. Please download it. Everybody wants to know how they can do something and how they can be productive and how they can help out the community, and that's one of the ways we can do that. Also, the governor announced a new Talk It Out hotline, which I may have mentioned last week. If you go talkitoutct.com, it's a great way it's a hotline for parents and caretakers in need of help with the stress and increased needs resulting from caring for your children during this crisis. It's available in English and Spanish from 8 to 8 Monday through Friday and 1 to 8 on the weekends. So if you need it, use it. It's there for you, and we certainly recommend that you do it. Community colleges, state colleges, and UConn will be using online learning for the summer. So if you're thinking about going to NCC or Central, Southern, Eastern, Western, or UConn, you'll be taking those classes over the summer online. Let's see, the governor has postponed the presidential primary from April 28th until August 11th, which is the same time for other primaries as well. And Connecticut has joined with 8 other states and more than a dozen student loan providers to offer 90 days of forbearance, waive late fees, guarantee credit protection, and more. So if you have a student loan, it doesn't have to be ones just in Connecticut. Please make sure you check with your provider to see if you qualify. Okay. Let's see, just trying to go down some things. So make sure if you're having symptoms, and again, this is going to be around with us for a long time, so make sure that you are understand that until there's more testing, which we all hope that there'll be more testing, that if you're displaying symptoms such as a fever, dry cough, shortness of breath, or maybe some of the other new symptoms that the CDC just put out today, that you should talk to your doctor and see if you have those symptoms and you qualify for a test. So you have to have a doctor's order in order to get a test. So we have new testing, rapid testing at Long Wharf off I-95 in New Haven. That's meant to be regional. They're looking to get 1,000 tests done per day. and you get your results in less than half an hour. So they are setting aside specific times just for first responders to get those tests. So that's a way to do that as well. If you're a first responder, it's a great way to get your results very quickly. We're still hearing from folks about unemployment claims, and we know that everybody is very anxious about that. The department is working 24/7 to upgrade and to get all those claims processed. Just because you've been processed does not mean you get paid. I'm learning all this stuff as we go along. So don't get upset if you get processed but you haven't gotten paid yet. I think it's a multi-step system. But if you have any questions, you can email me. That's no problem. Just Google me. You can send me a private message, and I'll give you my email address if you have any questions on that. If you're self-employed, a contractor, or a gig employee, you have to wait until April 30th to be able to get that, to be able to apply. Again, that'll probably take some time. But don't forget, they've gotten 3 years worth of applications in about 3 weeks. And the self-employed and gig economy folks, that's a brand new class of folks who can apply. So they had to build that system as well as they had to get done for other 49 states besides ours. So if you're not getting your money yet and you do get your money, you'll end up getting paid retroactively, including the $600. I don't even think Connecticut has gotten the $600 per person yet from the Fed yet, so I know that they're working on it. Lots of folks also are asking about reopening the economy, and that's obviously a very important thing. The governor has put forward his committees to help on that. There are a number of criteria to do that. The folks who are the head of that committee is Dr. Albert Coe from Yale, professor of epidemiology and medicine at Yale School of Public Health. Also, we have, who do we have here? Oh, Indra Nooyi, of course, who's the board chair of Advanced Connecticut and former chair of CEO of PepsiCo. And Paul Mounds, the governor's chief of staff, are all part of that group, but they also have broken down the subcommittees as well. So, but there are very specific criteria for us before we begin to reopen the state. 14 days of a downward trend of deaths and hospitalizations. So it's very important. Mass screening, contact tracing and isolation. There's enough PPE for hospitals and first responders and nursing homes and other healthcare places. And hospitals have to be back in service again. So Dr. Coe has said that is the criteria we need to reopen the state. So that's going to be very, very important. The president signed the new federal bill, kind of the CARES version 2, which is $322 billion for replenishing the PPP, which dried up last week. And $60 billion of that total will be allocated to small lenders and community banks. Now remember, credit unions have not been on the SBA.gov site, but if you're part of a credit union or you have a credit union in your area, you should go check it out because they may be able to do a little bit faster for you as well. Not saying to not use a traditional bank, but if you feel like you have a good relationship with a credit union, you should certainly try that as well. One of the biggest issues with PPP was the fact that small businesses and underserved communities struggle to compete with bigger businesses, and hopefully that'll be changed on this new round. So a big thing I put out and I want to thank everybody so much for responding to my video. I know that a lot of people have really stepped up and helped, and I really, really appreciate it. But we have a real food crisis in our own area here in Fairfield County. It is a major, major problem. It's not a problem someplace else. It's a problem right here. Demand for food is up 50% since early March, and it's picking up steadily. Person to Person gave me some information that they are providing food to 50 to 70 households daily in Norwalk, and that average household size is 3 people. So that's about 150 to 210 people per day, or enough food each day for 3,000 to 4,000 meals. So when you say 50 to 70 households a day, it doesn't sound like a lot. When you say to 3,000 to 4,000 meals, that's a lot. So we really need folks to help out. And food has been very, very difficult to source due to a variety of factors, including disruptions in our national food supply chains. So this is making food expensive or difficult to get. And there was a massive food distribution for folks in Danbury last week, and the Connecticut Food Bank ran out of food in 20 minutes, sending hundreds of people home empty-handed. So Person to Person's been able to purchase food that they need so far, but they're keeping an eye on a massive crisis. And if you provide food to Person, you can just go to p2phelps.org. If you can send a donation, cash donation in, that is great too, because they purchase in bulk, so they can purchase more food because they purchase in bulk. So you can then they can buy more with your donation. Demand for rental assistance is up 150% since early March. They expect to provide $100,000 per month to Stamford Norwalk residents for the next several months to help out with rent. So there's a big demand for rent as well, rental assistance. Let me just say, Person to Person is headquartered in Darien, has a location in Norwalk, serves Stamford and all the surrounding suburbs. So it's not just a city thing. They provide assistance to every single community around us. So really, really important to help our neighbors. So I really would encourage everybody to please make a donation, whatever you can, to Person. You can also give to Fill in Blanks, and they're based in Norwalk as well, and they do a great job helping kids in schools and make sure that there's food. They get rid of food insecurity at our schools. So Fill in Blanks does really, really great job as well, or the Open Door Shelter. So wherever you choose to give, Person to Person, Fill in Blanks, or Open Door Shelter, please do give, because it is really, really urgent. I can't believe I have to say this, but I do. So everybody pay attention. Please don't ingest disinfectants, and follow labels for any cleaning products. Whether it's Lysol or Clorox or anything else, follow the directions. The CDC has put that statement out, not me. Common sense, obviously. So please watch for the disinfectants and follow labels for any cleaning products. Don't use them for your personal self. Watch for scams. The IRS will not call you. Social Security will not call you, and only give to trusted charities. And you can go to, there's a website to look up trusted charities. But the ones I gave you, Person to Person, Fill in Blanks, Open Door Shelter, all trusted charities in our area, and I would certainly recommend, if you're going to give to them. The Mayor Rilling, is having a Zoom meeting Monday night. Go to norwalkct.org for details, and you can sign up and get the link for that. And Wednesday, Mayor Rilling is my guest on my Facebook Live, so you want to join me for that. Just like I had Dr. Amy Ahasek last Wednesday, I have Mayor Rilling this Wednesday at 7 o'clock. So that is my update for now. Let's see if I have anything else. Scrolling up my thing here. Nope, I think that's it. Everything else I have mentioned before. Also, just want to mention I'm wearing my Food and Commercial Workers, not mine. It was lent to me, Food and Commercial Workers vest here, given by my friend George Cabrera, who works for the United Food and Commercial Workers, just to give a little shout out to all the grocery workers and those who are on the front line working all the time, that's working right now on the front line, helping us every day. Grocery workers are getting sick. Unfortunately, grocery workers are dying. So we need to make sure that whenever we go to the store, that we social distance ourselves, that we have good habits, we have masks on, we don't crowd in, we do all the things that we're supposed to do, because they are putting themselves at risk. Just like I say all the time, no play dates, no sleepovers, do not get together with your friends, don't cheat, please. We want to make sure, of course, our postal workers, Smitty, absolutely. We want to say thanks to pharmacists, those who are in the banks, those who are in nursing homes, everybody else who is out there day in and day out working hard for us. We really appreciate it. George was nice enough to give me, lend me, like I said, this vest, so I could just say thanks to our grocery store workers and everybody else who's out there on the front line for us right now. So, okay, let me see if I have any questions. I know somebody asked about schools, and like I said, schools are closed till May 20th, and a decision will be made after that. I don't see too many questions that came through. Somebody asked about the best way to donate to Person. You can bring food down to them on South Main Street, or you can just go to p2p helps.org, and you can make a donation there. It's really simple for that. Let's see here. Let's see, status schools, I just mentioned that already. I don't think I have too many questions tonight. I try to give as much new information as I possibly can each time, and then just follow my posts that I do every night and every day throughout the day. Thanks, Minnie, good to hear from you. And Sky, how are you today? let's see, and I know, and Smitty Payne, who's a good guy over at the post office. I've known him for over 20 years now, much longer, actually about 30 years now. There's no food drive this year from the Postal Service this May, so that's why a lot of this is going to be even more important. Thank you, Michelle. A piece of cake by Michelle. Thank you very much. Let's see. Let's see. Let's see if I have anything else. Let's see. Whoops. Are they doing an emergency food share? Food stamp. There's different. Somebody, Babby Girl, asked me about an emergency food stamp. There have been some changes, I know, for food stamps, and just contact me if you have a specific question on that. So that would be, just shoot me an email or private message, and I can check for you, because you may have a specific circumstance on that, or somebody you know may have a specific circumstance on that. Okay, hold on here. And how do you sign up for Fill in the Blank? Just go to their, Fill in the Blank is more for, Babby Girl, I said, it's more for schools. I'm not sure what they're doing right now for people, but I would say that you should go to person first, and everybody works together, which is great. And how do you donate to Fill in the Blanks? Just go to their website. They have a Facebook page. They're on Instagram. They're on Twitter. Very, very easy to donate there as well. Run really, really well by a bunch of wonderful people and excellent volunteers. Are you required to wear a mask everywhere? You're required to wear a mask if you're going to be close to people. You're going to be close to people. So if you're, out walking and there's nobody around you, you don't need to wear a mask, in my opinion. If you're going to be going to a place where there's lots of people, or at the grocery store, or say the beach or something like that, I'd wear a mask. Now again, the beach is closed to vehicular traffic in Norwalk anyway. Darien, I think they're closed for everybody. But if you go to any place where there might be lots of people, or you can't safely socially distance, you should wear a mask. If you go out to pick up something at a restaurant, you should wear a mask and gloves. So you want to make sure that you are safe, and you want to make sure that understanding that this virus is very, very contagious, and it's very dangerous, and it's very deadly. So everything you can do to protect yourself and keep yourself safe, you should. And again, remember, masks are not the something to just make you feel like that's going to protect you. Only an N95 mask will help, and that only protects you from 95% of something. A surgical mask or a cotton mask will help, but it basically, as long as your nose and your face are covered, it only protects the other person from getting something from you, from your nose dripping or something, saliva coming out of your mouth. That's what you should. That's why the masks are important, but they're not important from getting something. It's important for you, preventing somebody from getting something you have. Let's see, how is Norwalk with the COVID? I'm currently in North Carolina. I'm worried about it with my family in Norwalk. COVID it's in the urban areas more, because there's more of us here, and we're more tightly confined, which is the same issue in Norwalk, same issue in New York and Bridgeport and Danbury and Stamford. But again, if people listen to what they should do, stay at home, socially distance themselves, wash your hands. When I talked to Dr. Amy last Wednesday, washing hands was really, really important. So if you wash your hands a lot, that is one of the best things you can do, besides staying home. And so, I think she was really great about saying, don't get overly, lull yourself into false sense of security with the masks. Make sure you're washing your hands. Masks are helpful, but they're not the end-all, be-all. But I think, we're seeing fewer hospitalizations. The hospitals seem to be doing okay. They're caught up okay. And that's where we are right now. So, hello, Gabby. How are you? Let's see. A small business owner, should I get into the application now or wait until the money's available? If you're a 1099 self-employed gig worker, you should wait till April 30th to go to the Department of Labor website before you file. That's what everybody says. So anyway, let's see. Thank you, Sky, for donating stuff to the ICU. Appreciate it. You're welcome for the info. let's see. Is Taylor Farms open? Yes, I believe it is open. Just be careful, again, with social distancing. I believe it's open. You might want to check the city's website, but I don't think it's been closed at all. Let's see. Debbie from Norwalk is making masks, and that's great. Love that. Let's see. What are your thoughts on how folks will social distance when it gets warmer? I see friends wanting to gather distance, but keeping 6 feet away from each other. Your thoughts? Again, we're fighting for our lives here. We're fighting for survival. If you want to, keep it at the most basic level. That's the most basic level to keep it at, is that we're fighting for our lives. And so, why risk something when somebody could actually end up testing positive and going in the hospital? Not everybody goes to the hospital, but there was an article in the Washington Post about people in their 20s and 30s who are getting it. Now, it's only a small percent, but who are in their 20s and 30s who are getting it and dying from strokes. So it's and that as a result from blood clots. So again, that's not to scare anybody, but they're finding more and more out about this virus as we go along, and it's not just older people who are at risk. Though I don't think any of us want to see our parents or grandparents needlessly put at risk, or be at the hospital sick by themselves because we can't go there because of the fact that we had to say hi to somebody for 5 or 10 minutes. So again, this virus is very dangerous, is very contagious, and is very deadly. So we need to keep the slogan should be, we're fighting for our lives. And that's why we're doing all these extreme things right now. If people are not following social distance, and you see groups of people gathering or kids gathering, please call the police. Because it's important that they learn. Now, it doesn't mean the police are going to arrest them or anything of that nature. It means that there's maybe some education that needs to take place so that they learn that if it's kids or adults or somebody else, that they are putting themselves, their families, and their community at risk. We're all in this together, and we need to get out of this together. So that's why that's important. Okay. Sorry. Alrighty. Do you wear a mask in a cab? If I were going in a cab, I think I would. Let's see. Sometimes these things. Let's see here. Let's see. What do people need to? That's what people need to hear. That's right. Do you have to wear? I would wear. If I was going into a place like that, yes. Because here's part of the thing, is that we just don't know how long this thing lasts in the air. There's different theories out there, and again, a lot of times the folks who are the scientists tell us one thing one day and another thing another day, and it's not because they're not telling us good information. It's because that they're just learning more things, and that's part of it right now, and so they're learning new things, and that's why the masks are important. That's why the gloves are important. Washing our hands has always been important. So these things really do matter. Let's see, up 81 new cases in Norwalk since yesterday. Is that daily increase, or is that the numbers is not always a day-to-day increase. It's just what's reported. So these are kind of total numbers and running numbers. But you look at it over time and over average, and the numbers keep going up. Again, the flu and other types of things are not this contagious, so you wouldn't see these kind of numbers over 5 or 6 weeks. This is extraordinary type of a pandemic that has literally stopped the world from moving, basically. What age? I would check the CDC website. I think it's over 2 or 3. But again, check the cdc.gov website and look that information up. I don't want to say because I'm not 100% sure, but I think it's. I know it's definitely 1 and 2. You don't. But I don't know if the cutoff is 3 or 4 or somewhere around there. Is Norwalk focusing on collecting antibodies, plasma from COVID patients? Norwalk Hospital has been getting plasma. They've been doing that. Stanford, I think, as well. A lot of these things right now are in the early stages. Again, this pandemic or this virus is only 4 or 5 months old, 6 months old. So there's collecting new things, and they're going to try lots of things and they're going to fail many times before they get it right. But that's why all these different tests are happening. So none of these tests are the miracle or the cure, but they're helping. Just like some people who contracted corona may never get it again, but other people who do may get it again. And we're seeing both scenarios. So that's why all these things are really important for us to think about. So anyway, I hope everyone's well. I think I've answered all the questions so far. Again, this is a very difficult time for folks. I hope you take care of yourself and each other. I hope you're taking care of your physical health and your mental health. It's okay to go out for a walk. It's okay to get some exercise. FaceTime your family. Don't always watch the news. I watch the news, but I don't watch it incessantly all day because it just makes everybody go crazy. I actually spent a lot of time today just on the couch catching up on a bunch of reading. I put my phone down. I was reading. It took a lot of stress off me because there were a lot of articles I wanted to read that I hadn't gotten a chance to read yet that were not COVID related. And I said to Tracy, I said it was like a little bit of luxury today, just having a chance to do some reading and quietly with my AirPods on and listening to some music. So, do those kinds of things. Like Tracy and I cleaned out the basement and cleaned out our storage room. And let me tell you, if any of you have kids and you want a good repellent from the kids because they're following you around all the time, tell them you're going to go clean a room, and they won't bother you until you're done cleaning the room. We didn't see our kids for hours while we were doing that. They were someplace else, the opposite side of the house. So if you want to break from the kids for some reason, just go tell them you're going to go clean a room, and you probably, even if you don't clean the room and you just want to sit in the room for a little bit and read, you probably get them to scurry someplace else. But anyway, so hopefully you see the humor in that. But it's been great having the family around. I have to say, it's having meals together every night and staying together and playing games and being with each other has been great. I've enjoyed it, and it's a part of the new normal, I guess. And so while there's inconveniences and there's stress and there's lots of other kinds of things that are happening, I think being able to be together more often has been a great thing, and that's I like that too. So. We get to have more conversations than we might have otherwise. Our legislative session would have ended May 5th, so I would have been in the throes of the session, probably not home very much. So this has been the exact opposite of what we would have had the legislature been in session, till May 5th, midnight at May 5th. So, okay, everybody, I think I'm going to call it a night. Hopefully you've all enjoyed it and gotten some information out of it. And if you'd like me to do this again next week, I will be happy to. Just let me know. If you can get some likes there, some hearts or whatever you have, you can put up there. That would be great. Because I just want to keep doing it. I'm happy to do it every time as long as people find value in it. No problem at all to do it whatsoever. So if you think this is a good idea, let me know. I'm happy to continue to do it. So I only try to give you some of the newer information. Some of the older stuff I skip over. But the newer stuff I try to just give you that information so you don't hear the same thing over and over again. Again, catch me on Wednesday at 7 o'clock on my Facebook page @Senator Duff, and Mayor Rilling and I will be there. And I have him as a great guest on Wednesday, and then next Wednesday after that, I have another great guest already lined up. I'm not going to reveal it yet. You'll have to just wait till after next week. So anyway, again, have a great night, everybody. Thank you so much. Let me just make sure I didn't miss any questions here. Let's see. Oh, hey, Pastor Prophet, how are you? Let's see. Unemployment package. When will it go into effect? Sorry about that. I didn't see your question there before, Pastor. Apologize. About the stimulus unemployment package, that should be, if you're asking about the stimulus payment, that should be coming soon if you haven't gotten it yet. If it's for unemployment for self-employed, apply April 30th. If it's for traditional unemployment, that you can apply for now, but some people have not been processed yet or paid, and the extra $600 is coming. We're just waiting for it to come into Connecticut. Okay, so I will be happy to do this again next week. Hi, Lori. All right, everybody, thank you so much. Have a great night. We'll talk soon. Bye. Bye, everybody.